The Controlled Acts and Other Restricted Activities Standard. It is every physiotherapist's professional responsibility to know and to follow the rules, regulations, and standards that apply to them and their profession. The current Controlled Acts and Other Restricted Activities Standard came into effect on June 29, 2016. Take a moment to get familiar with the expectations of this standard. They've been broken down into 7 main areas: authority and responsibility, education and training, managing adverse outcomes, communication with other healthcare providers, rosters for controlled acts, delegation, when another health professional delegates a controlled act to a physiotherapist, and delegation, when a physiotherapist delegates a controlled act to another health profession. Number 1. Authority and responsibility. Physiotherapists must have the authority to perform a controlled or legally restricted act. They get this authority from legislation, delegation, or a transfer of authority. This means every controlled act performed by a physiotherapist must be within the scope of practice of physiotherapy. Physiotherapists are responsible both for deciding to offer a controlled act and for performing it. And physiotherapists who are asked by the college must be able to show that they meet the requirements in this standard. Number 2. Education and training. Physiotherapists must be able to prove that they have successfully completed training for the controlled acts they perform. This can be formal education or training delivered on the job. During the training, the physiotherapist must learn the indications, contraindications, adverse outcomes, and risks associated with performing the controlled act. Practice the controlled act under the supervision of a person who is authorized to perform it. Be evaluated on the knowledge, judgment, and practical skills needed to perform the controlled act. And show that they are able to safely and competently perform the controlled act. Number 3. Managing adverse outcomes. Physiotherapists must know what to do if performing a controlled act results in an adverse outcome. Physiotherapists must have written instructions that tell them how to manage adverse outcomes that can be reasonably foreseen. Number 4. Communication with other healthcare providers. Physiotherapists may perform controlled acts that affect the care their patients receive from other health professionals. They must communicate with these professionals in a timely way. Number 5. Rosters for controlled acts. The college keeps rosters listing the physiotherapists who are permitted to perform each controlled act. To perform the act, the physiotherapist must be listed on the roster. An online list of physiotherapists who have declared they have the training, education, and experience to safely perform these higher risk activities. There are 2 exceptions: giving the patient a diagnosis and performing a controlled act delegated by another health professional. In this case, they can agree to perform it only under the conditions outlined under delegation, when another health professional delegates a controlled act to a physiotherapist. Number 6. Delegation, when another health professional delegates a controlled act to a physiotherapist. Physiotherapists must agree to perform controlled acts only under the following conditions. The controlled act falls within the scope of practice of physiotherapy. The physiotherapist believes that the delegating health professional can perform the controlled act safely, competently, and ethically, and has the legal authority to delegate it. The physiotherapist has given the delegating health professional all the information he or she needs to support the delegation. The physiotherapist believes that the delegating professional has met his or her own profession standards for delegating controlled acts, and the delegating professional has explained the circumstances in which the physiotherapist can perform the controlled act. This includes the patient or class of patients the physiotherapist can treat and any other limitations. The physiotherapist must explain to patients who gave them the authority to perform the controlled act. The physiotherapist must not delegate the controlled act to anyone else. And finally, number 7, delegation, when a physiotherapist delegates a controlled act to another healthcare profession. Physiotherapists may delegate the controlled acts they are authorized to perform, except for acupuncture, communicating a diagnosis, spinal manipulation, and internal assessment or internal rehabilitation of pelvic musculature. Physiotherapists who delegate a controlled act must have the knowledge, skills, and judgment to perform it safely, competently, and ethically. Physiotherapists are responsible for deciding to delegate the act and must document that they have ensured the person who will be performing the act has the knowledge, skills, and judgment to do so safely, competently, and ethically. Explain the circumstances in which the person can perform the controlled act. This includes the patient or class of patients the person can treat and any other limitations. Ensured that the person knows how to deal with any adverse outcome that can reasonably be foreseen and has a written protocol for doing this. And confirmed that the person knows they must not delegate the act to anyone else. And that's the Controlled Acts and Other Restricted Activities Standard. If you are ever unsure about the standard or have a question of any kind, reach out to the practice advisor. You can get in touch at practiceadvice@collegept.org or by calling 1-800-583-5885 extension 241. And be sure to have a look at the videos, frequently asked questions, definitions, and other resources that support this standard on the website, collegept.org.